Okay, well, I'm going to go ahead and get started, ladies and gentlemen. Good afternoon and welcome. My name is Branson Proctor. I am Enterprise Account Director here at Decisely, and we are very pleased and excited to present to y'all the South Carolina Realtors Health Benefits Center. We've been working in conjunction with your leadership there to round out a benefit offering for the independent agents that comprise the South Carolina Realtors Association. So we work with a bunch of other realtor entities, state level and national as well. And we're very excited to bring South Carolina under the fold here and present our offerings to you guys so that your specific sector of the American economy, independent professionals can have some real major medical group healthcare plans that you're establishing for yourselves, your dependents, and really give you guys some advantageous offerings here, as opposed to kind of what you've been stuck with, right, in the industry. Unless you have a spouse or a significant other who may have true employer-sponsored healthcare, you guys have really been limited in the amount of offerings and quality and affordable benefits to just what's on the ACA exchange with healthcare.gov and everything, or just some other maybe private solutions that you guys have had at your fingertips. So we're very pleased to announce the launch of this program. And we'll get started here. And if everybody, just a couple housekeeping rules, please do mute yourself for the duration of the presentation. If you do have a question, please just pop it into the chat feature here in the Zoom, and we will have an opportunity at the end of the presentation for me to go through and address everybody's questions. And if you want to maybe unmute yourself at that point in time, we can have a dialogue and discussion back and forth as well, to clarify and answer any questions or concerns that you guys may have. But again, thank you so much for attending, and we'll go ahead and get started here. So yes, just mentioned to you everybody, we're very excited and pleased to announce the SCR Health Benefits Center, the South Carolina Realtors Health Benefits Center. It truly is a for realtor by realtor program that we've been building for you guys here, and you'll see our website right there at the bottom right hand corner of your screen. We'll present this to you and show you guys how to go about getting your quotes in here in a couple slides. So how are we different? Okay. We start off with kind of three pillars of the program with how we are different. Okay. So we start off with a select group of individuals. Okay. We employ some unique cost saving strategies and techniques. And then we leverage the power of our numbers. Okay. With both of our major medical offerings that we have in place here, these three pillars are going to be paramount for how we're able to achieve not only the rates we're able to secure with you guys, but also with one of our programs, how we actually pay claims, negotiating the cost for the medical care and reaching a really true baseline and fair market value for the cost of medical services, and ultimately what you pay and your patient responsibility. And then thirdly, like I said, the power of numbers. Okay. There's a concept in any insurance, whether we're talking homeowners or car insurance, or in this instance, health insurance, where the larger of a population or a risk pool that you have that are banded together, you can spread that risk out amongst the many participants. Okay. That's why the Coca-Colas and the Home Depots of the world have excellent healthcare, because they are able to leverage the strength and the power of their numbers to spread that risk out and really leverage and utilize that concept that we're playing on here with aggregating the realtor members of South Carolina here with either of our programs that we have for major medical offerings. So who's this for? Okay. As I mentioned at the beginning, this is for that sector of the American economy that is y'all, the independent professionals, okay, the sole proprietors of the world, or 1099 contractors of the world, right? So what the qualifications and eligibility for this program, it is for sole proprietors and groups of one. Okay. So you do have to have your active real estate license number and NERDS number. Okay. You can be a local affiliate board member. You can be a local board association staff member with your NERDS number, but essentially you also have to be a member in good standing with the South Carolina Realtors Association. Okay. One other eligibility and requirement for both of our programs is that you're establishing coverage through your business entity. Okay, so through your S Corp or your LLC or your sole proprietorship. Okay, and so that is a requirement because you're essentially creating a group policy, but it's for a group of one, being yourself and any eligible dependents, spouses, or dependent children under the age of 26 that you wish to extend the coverage to. Okay, and because this is writing through your business entity, please do always consult with your tax professional or your CPA, because the premiums or the rates that you pay per month should be eligible for tax write-offs, okay, because you're paying it through your business entity, okay? So what's in it for you? Again, it's giving you guys the active autonomy and the control and the savings potential and the security of a group plan. Okay. Like I said, you guys have had limited number of options that have been available to you through, the state or federal exchanges, through healthcare.gov, or maybe some other, private alternatives that, may have given you, not a very wide breadth of network coverage, or, limited, benefit offerings, or very high deductibles and high out-of-pocket costs. And so what we're solving for here is giving you the security of the group plan, aggregating the individuals together, and giving you back some of that control that you've been longing for. So I want to start off with our flagship offering here for our major medical offerings. Okay, there are 3 plan designs to choose from, with a $2,500 deductible, a $5,000 deductible, and a $10,000 deductible. Okay, and what we do with this setup is it's setting you up in a private captive. Okay, so it's a private self-funded captive that you're establishing through your business entity. Okay, and you're aggregating together, as I mentioned, with all the other independent professionals who choose to establish their plan coverages as well with this. These 3 plan designs are what we offer in this captive strategy. You'll notice that it says right here, the deductibles equal the out-of-pocket expense. Okay, that's important to understand because most major medical plans nowadays have a deductible, but then they have a much higher out-of-pocket maximum that you have to reach, and you reach that with the co-insurance provision on your medical plan. Okay, whether it's 80-20 or 70-30 or 90-10, that's you cost sharing and splitting with the carrier. That's not the instance here with these 3 medical plans. Once you've met your deductible, you have met your out-of-pocket maximum and 100% coverage for your medical care for the remainder of the calendar year after you've met your deductible and your out-of-pocket maximum. Okay, these plans are ACA compliant. There's no pre-existing condition exclusions or waiting periods for those that qualify. Okay, no benefit caps or limits with any of these 3 vault plans. 2 of these 3 plans are HSA qualified, not has, but autocorrect in Microsoft here has it as has. It's actually HSA, or health savings account. Okay, our $2,500 deductible plan and our $5,000 deductible plan are HSA compliant and compatible. What that means is that you can open up a health savings account, which is essentially a tax shielding checking account, and you can fund that with pre-tax dollars, and then you get a debit card. And you can swipe that debit card when you go to the doctor for qualified medical, dental, or vision expenses. Okay, use those funds tax-free. And all of these plans have pharmaceutical coverages, and all the big box, pharmacies are able to be leveraged and utilized with these plans as well. So this is a graphic here for these 3 vault plans. As you'll see here, the 2,500 and the 5,000 plan are HSA qualified or HSA eligible medical plans. The 10,000 plan, it functions the same way with regards to how costs accumulate towards your deductible and your out-of-pocket maximum, but it does exceed the limits of the IRS with regards to deductibles and out-of-pocket limits to not be an HSA compliant plan. Okay, and what you'll notice here, I mentioned the individual deductibles and out-of-pocket maximums are the same: 2,500 on this plan, 5,000 on this plan, and 10,000. Now, if you have a family, which is defined in this instance as more than one individual, so primary plus spouse, or primary plus any number of children, or primary spouse and any number of children, you would then get into the family. Okay, so you would then double the deductible and the out-of-pocket maximum on all of our plans. Okay. But you'll see here that, again, 100% coverage for your major medical costs after your deductible and your out-of-pocket maximums have been met. Okay, and how these plans work is they are high deductible health plans, meaning everything, when a claim comes in, is going to accumulate towards your deductible and your out-of-pocket maximum from day one. Okay, it won't have a fixed dollar amount called a copay or copayment for cost of care. Okay, it will still be reduced and negotiated cost for care once the claim comes in. Okay, but again, everything will accumulate towards your deductible and your out-of-pocket maximum from day one on these medical plans. These plans are contingent upon your demographic information, okay? And the savings, depending upon your age, your gender, and your home zip code, could be great. These are some examples that we had for our Georgia Realtor partners who have launched this program in 2021. This graphic here shows 3 individuals who what their costs that they were paying for their major medical care in plans in 2020 versus what they were able to secure on a monthly basis with superior coverage with our plans in 2021. So annual premium savings right there in the thousands of dollars. Okay, so real cost savings here with regards to the premiums that we're talking in the rates based upon, again, your demographic factors with these 3 vault captive plans. This is another case study here for another one of our Georgia Realtors. She was paying roughly 28 grand a year for her healthcare coverage in 2021. Okay, she switched over to our Georgia Realtors plans with these vault captive. She saved $16,000 a year for her family of 3. Okay, in addition to the premium savings, with how we pay claims under this vault program, we actually are able to save on average about 72% off of the original claimed billed amount. Okay, whatever comes in from the medical provider to the carrier, that initial claims billed amount. With the vault programs, how we pay claims is we actually, as I mentioned earlier, we try to get to a uniformity and a baseline and a fair market value for the cost of medical care services. And so we, on average, save members about 72% off of that original billed amount, which ultimately ends up being their patient responsibility. So again, not only great savings with regards to the monthly rates or the premiums for these plans, but also the cost for medical care and services itself. In these savings, they enabled Allison here to purchase additional coverages that we offer, dental, vision, and some ancillary coverages as well. All right. So those were the vault plans that we have available to members to choose from. Okay. There is a short medical questionnaire on these vault plans. Let me just go back here to those slides as well so you can see that. So again, tax ID is required, federal employer identification number, and there is a short medical questionnaire that members and their dependents would have to answer no to qualify for these vault medical plans. Okay, that's where I was referencing a select group of individuals as one of the pillars of this program. We try to start off with as healthy of a risk pool as possible. Okay, but about 90% of those that apply for the coverage end up qualifying for these vault plans. Okay, again, the purpose of that is not to exclude members or to knock people out. What it is again, the way we're able to pass on such great premiums or rates to our individuals is by starting off with as healthy of a risk pool as possible. You'd be surprised, but statistics show in this industry, only about 7% of a given population account for about 80% of the total claim expenditure or the claims that are paid out. So again, what we're trying to do is account for that and start off with as healthy of a risk pool as possible in these vault plans so that we can pass those savings on to the members that qualify in the form of reduced premiums. And again, about 90% of those that will apply for the coverage will end up qualifying for these vault plans. Okay. Now, if you don't qualify for the vault plans, we have an option for you. Okay. We have some great options here, 6 major medical plans to choose from, and they're actually through a union. Okay. It's called the Local 426 Amalgamated Health and Wellness Fund. Okay. These are guaranteed issue, no medical questions needed to qualify for these plans, and it utilizes and leverages Anthem's largest nationwide PPO network. Okay, it's their Blue Card PPO network with Anthem, which covers over 98% of registered and licensed providers and facilities in the United States. Okay. Again, this is an alternative for folks that either don't qualify for the vault captive plans or those that want the comfort and security of the Anthem name brand with regards to the network of coverage here. A couple of bullet points on these plans. These are static rates, whereas the vault plans are based upon your demographic factors, your age, your gender, and your home zip code. These rates are static across the nation for anybody, regardless of age and gender and zip code. And these are the rates here that we're showing on our screen for primary only for a monthly rate, okay? You'll see it has a wide range of deductibles, okay? Can be offered down to a group of one level. Again, you must still utilize your tax identification number for the business entity you own, all right, to qualify for these plans. But again, there's no additional duties or responsibilities or fees associated with joining these union plans, okay? And so again, 6 medical plans to choose from here with the great name branded recognition of the Anthem PPO network for individuals to participate in these major medical options, okay? But it doesn't just stop with major medical coverages. We also are offering some great supplemental or ancillary coverages available to SCR members as well. We have partnered with Sun Life to offer you guys 3 dental plans to choose from, okay? We have 1 vision plan to choose from, and then we have a couple of options here for accident, critical illness, and hospital indemnity coverages, okay? Dental and vision, you guys know what those are. You know, it's a great to support, you know, your dental hygiene and eye care, because if you take care of your eyes and you take care of your mouth, you know, you can catch things that may later on become more systemic and more chronic issues with regards to your health. So oral hygiene and ocular hygiene is always of the utmost importance as well when trying to round out a holistic view to your healthcare needs. Now, accident, critical illness, and hospital indemnity, we call these ancillary or supplemental coverages because they can supplement your major medical. Okay, what these policies do is they pay lump sum cash payments for accidents or injuries, hospital stays for hospital indemnity, or critical illness or cancer diagnoses, so heart attacks, strokes. So if any of those injuries or accidents or illnesses get diagnosed to you, or if you have to get admitted to the hospital, what those policies do, based upon the product or the plan that you select, would pay you lump sum cash payment for that specific injury or illness. And what people do is they use those to help meet their major medical deductible. Okay, so it's a great way to layer your coverages and, you know, again, build a holistic and well-rounded view of your overall healthcare needs. Now, for January 1st, 2023, we are adding voluntary life insurance and short and long-term disability coverages as well, okay? All with Sun Life. So again, you'll have dental, vision, accident, critical illness, hospital indemnity, voluntary life insurance, and short and long-term disability coverages to choose from. Now, all of these are a la carte, okay? So you don't, it's not a take them all or none type of thing. You can pick and choose which policies and coverages that fit your specific family needs the best. Another exciting topic that is coming out soon for 2023 is Medicare. We will actually have the opportunity for independent agents and South Carolina Realtors to partner with United Healthcare, our partner that we're taking on with this, to enroll in some Medicare coverages. Okay, and that'll all be on our website as well for members to take advantage of if you're over the age of 65. Now, one of the biggest questions we get with regards to the medical questions, as I was referencing, that start with the vault coverages, with the vault captive, is what are those medical questions needed to qualify? Okay, and it's broken down into 5 sections, or 5 questions, if you will. The first one is regarding some prescription drug coverages. Okay, within the last 5 years, if you've taken any of these medications or are currently taking them. The second question is listed towards anybody who's currently pregnant, undergoing any fertility treatment, or in the process of adopting a child. The third question is a bunch of bullet points there, but it's within the last 5 years. Have you ever received any medical, surgical advice, consultation, or treatment, including any medication for any of those following bullet pointed illnesses or diagnoses? And then the last 2 are geared towards some autoimmune disorders and AIDS-related complexes, okay? So again, 5 medical questions here. These are what we would ask for members and their dependents to qualify for the vault coverages. But keep in mind, if you don't qualify for the vault coverages, we still have you the great options available through our union products that utilizes that Anthem nationwide PPO network, okay? So I have come to the conclusion of my presentation here. I want to go back to our main slide here with our website, but I do see there are some questions in the chat box here. Sylvia asked, will the recording be available? Yes. Yes, it will be. John, I think I was on unmuted the whole time.
And actually, Branson, if you go down to the first question is about the copay option. Charles is asking about that. Skip down a couple.
Yep, I see it there. Charles has a question. Is there a copay option? Yes, there are. Right. So the vault plans, like I mentioned, those are what we call high deductible health plans. A claim comes in, it gets reduced and negotiated. Everything from day one, from a medical and pharmaceutical standpoint, will be a reduced negotiated cost, but it will accumulate towards your deductible and your out-of-pocket maximum. After you've met your deductible and out-of-pocket maximum on the vault plans, your prescription drugs do kick in at a copay level based upon the tier of the drug. Right. So a fixed cost for a 30-day supply for tier 1, 2, and 3 and beyond drugs. Now, from day one, though, on our union plans, okay, the amalgamated local 426 plans right here, these are all of these offer some level of copay options from day one. Okay. So, you know, office visits here, you can see on this Blue Liberty plan, primary care is a $30 copay from day one for your office visits. Specialist visits, a $50 copay from day one. So all of these plans do function in some way, shape, or form as more traditional copay plans. Okay, it's just what, you know, a few of them have slight differences with regards to, you know, right here on this base plan, you'll see office visits do accumulate to the deductible. However, prescription drugs on this base plan from day one do have copayments that would apply. Okay. So Katie asked, can we get a hard copy of the presentation? Yeah, we'll probably be sharing this out with SCR leadership, so you guys can reference this. Okay, Katie? Who is the health coverage through? Blue Cross Blue Shield. So two parts there to answer that question, Frank and Liz. With Vault, Vault is essentially the carrier in those setups with the captive arrangement. Okay, so with the Vault plans, you can think of Vault admin services as the carrier for this private captive arrangement. Okay, with the Vault plans, we do have a built-in nationwide PPO network of doctors' offices only. However, the Vault plan works with how we pay claims on an open network concept. So for any doctor that is not in the national PPO network that we leverage for those 3 Vault plans, we don't have an in-network contract with hospitals, doctors' offices, medical facilities, pharmaceutical facilities. What does that mean to you? That means you can go to anybody. It's an open network. We pay the claims for any provider in the United States, regardless of who they are or where you live and work. All the provider has to do, or the facility has to do, is to just submit the claim with the information on the back of your ID card. But for these plans I'm showing here on the screen right now, the network that is leveraged is Anthem Blue Cross Blue Shield. It's their largest national PPO network, called their Blue Card PPO network. Okay, so kind of 2 distinctions there. Sherry has a question. For the Vault program, the plan requires you to meet your deductible before benefits or coverage starts. But by working in network, you are potentially able to save approximately 72% on the bills. So Sherry, to clarify on that, yes, everything for the cost of medical care and services and your prescription drug coverages are accumulating towards your deductible and your out-of-pocket maximum from day one. However, you're not going to pay that initial claims billed amount. Okay, when a claim comes in, it's going to be adjudicated and reviewed and negotiated down, and that's where that 72% on average savings comes into play with the Vault plans. That is a statistic from our vendor partner and our carrier Vault, and how they pay the claims. On average, members who have enrolled in these programs have saved about 72% off of that initial claims billed amount that was submitted to the carrier. Okay, so for example, on the Vault plans, for a doctor's office visit, right, on one of these Vault plans, the doctor may submit a claim for $250. We'll whittle it down to a fraction of that for you, and it may end up being $100 on your patient responsibility. That $100 will accumulate towards your deductible and your out-of-pocket maximum on these Vault plans. Sharon says, I heard you say you offer service in Georgia. How about Florida? All of our plans, regardless if we're talking the Vault Health plans or the Union plans, offer national coverage. Okay, the Vault plans again have a national PPO doctors network, but then for all other claims, we have that open network, meaning you can go to anyone in the entire United States. All the provider has to do is, and we're willing to work with everybody. All the provider has to do is submit the claim with the information on the back of your ID card. And then for our union plans that leverage the Anthem Blue Card PPO network, that is Anthem's largest PPO network, coverage in all 50 states. So that shouldn't have a problem with either plan finding in-network doctors and facilities that work with the insurance. Elizabeth has a question. Do copays count towards out-of-pocket maximum? What about prescriptions? Yes. So on our Vault plans, everything medical and prescription drug coverages is going to accumulate towards your deductible and your out-of-pocket maximums from day one. After you've met your deductible and your out-of-pocket maximum, either individual or family, 100% coverage for medical after that, and then your prescription drugs on the Vault plans kick in at a copay level. On our Anthem Union plans, copays it do accumulate to the out-of-pocket maximum from day one and prescription drugs as well. Yes, ma'am. Are any of the Anthem plans eligible for HSA? Ryan, unfortunately not. None of the Anthem Union plans are what the IRS considers qualified high deductible health plans. And the reason for that is because of how all of the plans have some way, shape, or form of copays that would apply from day one. And that disqualifies them from being HSA compliant on the Anthem side of things. Sherry says, how often can or does your premium go up, and is there a cap percentage limit? Your rates are locked in for a 12-month period. So if you guys enroll for January 1st, 2023, your rates will not change. You are locked in for a 12-month contract with regard to the rates being fixed. And again, neither of the plans have benefit caps or limitations. So, you know, you could rack up $1 million in claims and there will be no cap on what the plans will pay for covered services. Oops. Let me go back here. All right, so another question. Would I be responsible for 100% of the cost until I meet the deductible? Charles asked that. So, no, Charles. Again, whenever a claim comes in from a provider on the Vault plans, what our carrier does is we adjudicate that, review it, look at and see at the invoice if there's any errors or duplicative charges, and then we reduce and negotiate the cost for what we actually pay the provider, and then ultimately what your patient responsibility will be. So yes, whatever your patient responsibility will be, that is what will accumulate towards your deductible. But again, it's not going to be whatever the initial bill to incur to claim amount will be. Excuse me, I had to take a sip of water. Marilyn asks, when is enrollment? Is it during the normal open enrollment period? The answer is yes. So our plan is to have everything launched here very shortly. It may even be live right now, but we are looking to have us aligning 1/1/2023 effective dates at the absolute latest by November 1st, when the exchanges open up for 1/1/2023 effective date, so January 1. So yes, you can enroll every single month of the year though with all of our plans. Excuse me. So what I mean by that is, yes, we are aligning for open enrollment period here towards the end of the year to align starting at the absolute latest November 1st for January 1st effective date. However, with both the Vault plans and the Union plans, you can enroll for February 1, March 1st, April 1st, on and on throughout the course of the plan year. We do allow for those enrollments as long as you enroll by the 15th of the month prior to your desired effective date. So for example, if you want a February 1st effective date, you would need to sign up through our system and establish coverage by January the 15th. If you wanted a March 1st effective date, you would need to sign up and establish coverage by February 15th. Okay. And then again, all of our plans, like I mentioned, with regards to the Vault captives and the Union products, do operate on a 12-month calendar year deductible and out-of-pocket maximum. Okay. So if you do enroll February, March, April of next year, you will have a shorter plan year, okay? And we will renew come January 1st, 2024. Who do we reach out to for individual questions? On our website, we should have a email and or a phone number there. Or if you've actually created an account with us, once you see the rates and you proceed to create an account with us, there's a chat functionality where you can speak to one of our call center representatives. You may end up speaking to me if the issue or the question gets escalated, Katie. So we will have numbers and contact information available on our website, screhealthbenefits.com. Okay, but you can end up speaking to one of our licensed representatives, or you may end up even speaking to me. Who is the national network for the captive plans? Great question. It is the largest private PPO network of doctors' offices only, and it's called the PHCS Multi-Plan Network. Okay. And when you're on our website, you'll be able to click the link to find a provider when you're seeing those vault plans, and you'll be able to search for doctors within that national PPO network, Tina. Again, it's the PHCS Multi-Plan Practitioner Only or Doctors Only Network. What is the difference between the Vault PPO network and the open network as far as coverage? Again, as I mentioned, the Vault PPO network that we utilize in those Vault plans is for doctors' offices only. It's the largest private PPO network in the nation for doctors' offices only. However, if your doctor's office is not in that PPO network, or for any other medical or pharmaceutical claim, that's when the open network kicks in. And again, Vault will work with every provider, every facility. All the provider in the facility has to do is submit the claim, and they will get paid. Let me see here. I'm on the website now looking at coverages. The medical would start immediately. The dental and vision say 2023. I will be paying for dental and vision before it's active. No, so great question. So the Sun Life benefits do have only 2 effective dates, okay? You can sign up for January 1, 2023, or after that enrollment period ends for January 1, you can sign up for 7/1, 2023, okay? I apologize for the confusion there. Our medical offerings have monthly enrollments every single month of the year. Our Sun Life dental, vision, accident, critical illness, hospital indemnity, voluntary life insurance, short and long-term disability. You must sign up by that by 12/15 to secure it for 1/1. After that date, you can sign up, but the next effective date for those Sun Life products will be 7/1, 2023. There's only the ability to do 2 enrollment periods for those products with Sun Life annually.
Hey, Branson, if somebody's on the website now, just want to reiterate that a 10, the cutoff, you could technically right now get 11/1 coverage up until 10/15. But if you do so, you will have to renew if it's a captive plan. If you do 11/1 coverage, you will have to renew for 2023. Once 10/15 ends, the next available effective date will be 1/1/2023.
Thank you, Jason. So Sherry asks, have hospitals or doctors push back in filing claims with Vault? I've used MediShare and hospitals consistently push back. Wondering if that would be the same situation. So this is completely different than MediShare or any of those, sort of kind of Christian or faith-based sort of kind of co-ops, if you will. This Vault program is real major medical insurance. It is a licensed, registered, and domiciled with the North Carolina Department of Insurance for a private captive setup. Okay. Has there been instances where the provider is not familiar or doesn't recognize Vault immediately? Yes, of course. But then it's just as simple as getting the Vault individuals to call the provider and explain how the program works, and it gets cleared up. Less than 1% of cases, and to your point, meaning 1%, less than 1% of claims get escalated to a point where there's further negotiations or back and forth that needs to be occurring with the hospital or the provider. So, over 99% of the claims are able to be resolved and submitted on the first attempt there. But the key is communication, because just to further elaborate on that a little bit, Sherry, because it's a great question. Has it happened before? Absolutely. But it happens at a very, very small percentage of the time, because what you have to understand is the individuals at the doctor's office or the hospital, they're an hourly, probably paid employee there. They're just doing what their boss told them to file, and they look for the big box carriers most of the time, right? They look for the Anthems, the Cignas, the United Healthcares. And they say, oh, the initial response may be, oh, I'm sorry, we don't accept this. But what they don't know is that because of this open network concept, and it is true valid insurance, they will get paid. All they have to do is just submit the claim. Okay. And so sometimes it takes the vault representatives to contact the doctor's office and explain it. And then, like I said, over 99% of the time, the claims are able to be submitted, and there's no back and forth or any issues with the provider being paid or the claim being filed. And you're welcome. Charles says, I have an LLC and my tax professional has always filed using my SSN. Would I be required to apply for EIN? Yes, Charles. So again, for both of our major medical plans, even if you have an LLC but still use your Social Security number for your taxes, we would need the Federal Employer Identification Number, or tax ID, for an LLC, INC, S Corp, whatever the structure of the incorporation of the corporation that you would create would be. So again, that is a requirement for both of our major medical plans with regards to the vault captive and with regards to the union Anthem products. Nikki asks, my husband and I are both realtors. Would a NERDS number and in good standing, would pricing be cheaper to have our own policy than adding a spouse on one plan? You could look at it, Nikki, to answer your question. Since you guys both would qualify individually, and you can even, if you guys co-own the business that you would use to qualify as well with that tax ID, that could work. You could have, you guys establishing coverage individually or together. You could actually just, run the numbers on our website and see which works out better for y'all. But to answer your question, it's really whatever is, preferential to y'all from a cost standpoint. Which programs do diabetics not qualify for? Okay, so the vault captive plans do have the one question on there that says diabetes with any insulin treatment as a disqualifier. So if you have diabetes and have insulin treatment, unfortunately, you wouldn't qualify for the vault plans. But if you're a diabetic and don't have any insulin treatment and everything is well maintained and controlled with diet and exercise, then you would qualify. It's just that the insulin treatment is the kicker there on the vault captive plans. Charles asks, I will be 50 in a few weeks. Happy early birthday, Charles. If I get my rate quoted now, will my premium increase after my birthday? Not if you lock in coverage before 10/15. As Jason mentioned, I believe we have the ability now for folks who need coverage now on our website to enroll by October the 15th for an 11/1 effective date coverage. However, if you come back after you turn 50, and you secure coverages at that point in time, your rates will be that of a 50-year-old. But to answer your question, if you lock in coverage before Saturday, your rates will not change after you age in a plan year, if that makes sense. Your rates are locked in for that plan period. But again, as I referenced earlier, and as Jason referenced, all of our medical plans renew, okay, at a calendar year basis. So for every January 1st. So if you enroll in the vault captive plan for an 11/1 effective date, we are going to send you an email sometime in November for you to log back in and renew your policy. And there may be some slight rate changes with the renewals there. What about RX coverage on vault? It's included, John. All full pharmaceutical coverage is included with our vault captive plans. It's just, like I said, how the plans work. Everything from day one will accumulate towards your deductible and your out-of-pocket maximum with that reduced negotiated amount for the cost of care or your prescription drugs. After you've met your prescription drug, or excuse me, your total out-of-pocket maximum and deductible on the vault plans, your prescription drugs do then kick in at a fixed cost amount or a copay level based upon the tier of the drug. Elizabeth asks, how do your rates compare to Obamacare? Well, that's a case-by-case basis, Elizabeth. You know, I don't know what your level of income is, or you know, specifically your demographic information, or even what plans are available to you in your specific area. What I can say as a general rule of thumb with you know, comparison to the ACA exchanges is that, you know, based upon your level of income, and if you qualify for subsidies, what overwhelmingly I've found on the ACA exchanges is that you have really limited, narrow networks of doctors and facilities, whether it's an HMO plan or a really restricted network of doctors and facilities in a PPO plan, really regionalized coverage. And then also, as I mentioned, the richness of the benefits. You'll probably find on the exchanges that, you know, you may have lower deductibles or a wide range of deductibles, but, you know, huge amounts of out-of-pocket maximums, you know, approaching, you know, 8,000, 8,100 for an individual. So again, that's a case-by-case basis, Elizabeth, that I can't really, you know, accurately answer. It's really based upon the specific individual or household in regards to what you may be able to qualify for on the ACA exchange. Again, if you have any subsidies that are coming your way based upon household income. Tina asks, how are hospital claims negotiated with PHCS network? The PHCS network, Tina, is only related to doctors' offices or doctors within that PPO network. Hospital claims, outpatient surgery facilities, laboratory facilities, pharmaceuticals are all done with the open network contract, okay, or with the open network concept with this plan. There is no in-network contract with any doctor's office or facility outside of that PHCS multi-plan network, okay? Claim comes in, gets submitted, they review it, they negotiate it, they reduce it amount, and then you'll get an explanation of benefits after the doctor or facility gets paid with your patient responsibility. And that's what will accumulate towards your deductible and your out-of-pocket maximum. Jamie asks, can a significant other be added to my plan? So with the vault plans, we allow domestic partnerships and same-sex marriages and heterosexual marriages as well. With the union plans, it does have to be you have to have a valid marriage license to enroll a spouse on the union plans. Okay, so there has to be some sort of legal domestic partnership and or marriage on the vault plans. And then on the union plans, there does have to be a marriage license to add a spouse to the plan. Yes, Rose, both plans do cover chiropractic care. Okay, there are caps on the number of visits per year, but both plans do cover chiropractic care. If I do not have an LLC, can I use my SSN? No, Elizabeth, unfortunately not. That is a requirement for both the programs from a compliance standpoint. You're qualifying as a sole proprietor or a business of one or a group of one. Now, if there's a limited partnership with multiple owners of an LLC or a business entity, those individuals can qualify. But the kind of technical definition is a business entity with a valid tax identification number with no W-2 employees being paid by that business entity, other than if your structure is that of like a S Corp where you pay yourself as a W-2 as an owner of that business entity. Unfortunately, we cannot have social security numbers. It must be a federal tax identification number to qualify for either of our major medical plans. Barbara, we are recording this and we will share it out. We'll probably actually post it to your website. So I know you're just signing on here a few minutes ago. So yes, this entire session will be recorded and shared. We will post it on the website. Yes, Tricia. What if I have a policy now that renews in January? I don't wish to pay double. Do I just cancel my current policy if I enroll now? Absolutely. You can cancel now if you enroll for an 11/1 effective date. You would just need to let them know before before the 11/1, but after you secure coverage on our website and get our confirmation email letting you know that you're done, just so you don't have any lapse in coverages at all, Jamie. Yep, and our website there, Maren, is screhealthbenefits.com. Great questions. Sorry, I need to take another sip of water. Any other questions or comments from the participants here? No? Okay. Well, if there's no other questions, I can give you, oh, Jamie missed the answer. So if you have a policy that renews in January and you wish to enroll now for an 11/1 effective date, you absolutely can do so. And you can cancel your current policy, or you should be able to cancel your current policy with just advance notice to the carrier. Now, that's how most plans work, okay? With regards to termination, just like, you know, auto insurance or homeowners insurance, if you find a better deal with a better plan, you can cancel at any time as long as you have it advanced, either written or you know, some form of communicated notice to your current carrier.
And guys, if you want to unmute and just ask Branson a question directly, you can too.
Yeah, sorry if I didn't mention that. Yeah, and thank you everybody for, while I was doing the presentation, to put your questions in here. But if you want to unmute yourself right now, you can ask a question direct instead of typing it out. But again, I encourage everybody to visit our website, just, you know, compare and contrast. I know everybody is coming up upon that time of year where, you know, the majority of the American population, you know, has their health coverages starting or renewing for January 1st. And so again, we wanted to align the launch of this program to coincide with that. And so again, as we mentioned, we do have from now until October 15th, opportunity for individuals to establish medical coverage for 11/1. You can now enroll and establish coverages on your Sun Life products now, but those won't take effect until January 1st, 2023. And then after October the 16th, sometime in that time frame, we're going to update our systems and allow for individuals to enroll for 1/1/2023. Okay. Thank you, Sherry. All right, so again, here's our website, everybody, screhealthbenefits.com. Okay, all you would have to do is you can read on our site, you know, a little bit more, basically everything I've regurgitated about the program and eligibility and requirements on the website. But to get started, you'll just go on the right side of that page, plug in your demographic information on the right side of the page, click calculate, and then you'll be presented with all the plans and the rates that are available to you to select and choose from. And you can tab through the different options to see the rates and the premiums for each plan and each program. Okay.
Branson, you did have one more question. Elizabeth wants to know how she can get pricing for January coverage.
I'd like to know as well, Elizabeth. We're actually waiting on that. It'll be available shortly, Elizabeth. So just as soon as we get updated costs from our carriers and vendor partners, we will update our websites and make it and publish it out, and we'll blast it out to the members to let them know. But it'll be very shortly.
I don't see anything else in chat, so I think you're good.
Okay, ladies and gentlemen. Well, thank you so much. Again, we're going to record this. We'll put it on the site for distribution. And thank you again for your time today. We're really excited. We really appreciate the opportunity. We look forward to working with you. And please let us know if you have any questions or concerns. Again, screhealthbenefits.com. You can email us. And then again, once you create your account, you'll have the ability to chat with our representatives. And again, you may even come and talk with me because I got my hands in a lot of places, wear a lot of hats over here. So happy to chat with you guys and answer your questions and concerns. Thank you again for your time today, and have a blessed and wonderful rest of your day. Thanks so much.